Now, there are signs the rate of new infections in Germany is slowing down. The head of its Institute for Disease Control is attributing the change to social distancing measures. Germany has more than 26,000 cases and 111 deaths around that.
Sehen einen Trend, das heißt,
We are seeing signs that the exponential growth curve is flattening off slightly, but I will only be able to confirm this trend definitively on Wednesday. I am optimistic that the measures are already having an effect, which is very early because they have only been in place for a week.
Ein Kernelement ist genau diese
One core element is the ability to keep track of contacts, the quarantine of contacts for a duration of 14 days, and the isolation of infected people. These measures must be strictly adhered to for the coming weeks and months.
Well, very interesting what could be happening in Germany. Let's take it on. We can speak now to Dr. Mohammed Munir, who's a virologist at Lancaster University. Joins us on Skype from Lancaster in the UK. Doctor, if this is the case, that we're seeing rates flattening out, why do you think it is so? Because of the restrictions that have been put in place?
Well, the restrictions that are being put in place, these were just like a couple of days before, like locking down or limiting the number of people in a gathering. So I don't think that these are the things that are making the difference. If it is making the difference, then it is only down to their timely actions. I think Germans have been relatively quick in applying the phenomena like test, find, isolate, and treat every individual cases you can do so. And by that way, they not only have limited the number of infection, but at the same time, they really have limited the spread to the vulnerable community. Because if we look onto the proportion of the elderly people, that is not any significantly different than Italy. So the thing is that at this moment, if you take the average, mean average of really the people who are died, is really young population is like 46 is in Germany compared to like 63 or 64 in Britain and Italy respectively. So I think the major impact they are seeing now is really the timely action in the beginning they have put in place.
Right, and that's the thing, what you referred to there. The numbers of those getting infected has been perhaps comparable to Spain, but the small fatality rate, the small number of deaths relatively, is the thing here. What factors on the ground would create that?
Well, it's really too difficult to conclude anything here. First, because the disease has not completed its natural course yet. Although we started seeing decrease in number of cases in just 1 or 2 days, that's probably too early to conclude anything. But one thing that certainly had made impact is the proportion of the COVID positive cases were in the younger people. So that means that they would have a higher chances to survive and therefore having lower death rate in Germany. But at the same time, it also been noticed that the German intensive healthcare system has amplified quite significantly, claiming that they have like 25,000 intensive care beds compared to 5,000 or 6,000 in Italy, France, and in the UK. So therefore, they got a little bit more time to prepare, and that is where it's going to help to really treat every patient who needs it.
All right, well, let's spin it forward to what is happening in the UK. Given this experience or what's going on in Germany, what could be good news in Germany, how do you think it bears out for what's happening in the United Kingdom, given the precautions that have been taken there?
Well, certainly, I think everyone, not only in the government, but in the scientific community, we do understand that the action plan has been really too little, too late. Because the overall phenomena, British government is really working now is on mitigation and the suppression of the curve so that the burden onto the healthcare system is reduced. But unfortunately, the overall number of cases, even in a prediction or the one those are confirmed, they are not any difference than any other country who have not put the control measure right at that time. So therefore, the trajectory are really moving toward the same direction as Italy, Spain and France are moving. So certainly the next few weeks are really difficult to bear.
Right, critical time, certainly. Dr. Mohammed Munir, great to get your perspective on this. Do appreciate that. That's Dr. Munir, a virologist from Lancaster University.